In today's rapidly evolving world of health and wellness, it's easy to overlook the subtle, gradual changes our bodies undergo. Yet for many older adults, one of the most critical and often unnoticed transformations is the steady erosion of muscle mass. Understanding the root causes and discovering effective countermeasures can mean the difference between continued independence and a life constrained by mobility challenges. It is noteworthy that by the age of 70, individuals typically experience a loss of approximately 40% of their muscle mass, often without any awareness of this decline. The gradual decline, referred to as sarcopenia, is currently occurring within your body, gradually eroding your independence with every day that goes by. Research from Johns Hopkins University indicates a concerning trend. Seniors experiencing substantial muscle loss face a 320% increased likelihood of developing mobility disabilities that may result in confinement to wheelchairs or nursing homes. The alarming reality is that the loss of muscle mass accelerates significantly after the age of 65. And the common belief that this is simply a part of aging has obscured a widespread issue of avoidable muscle decline globally, which is particularly concerning. Many healthcare professionals often overlook a vital vitamin deficiency that may be contributing to your current muscle loss. This often neglected nutrient, in which 78% of seniors are alarmingly deficient, may be the key factor in preserving your independence versus relying on others for essential daily tasks. However, there is some positive information to share. Recent research conducted by the National Institute on Aging has pinpointed 6 distinct vitamins and nutrients that possess unique compounds capable of reversing the muscle wasting process, even in individuals in their 70s and 80s. Perhaps the most surprising aspect is that the top supplement on our list features a compound that remains largely unrecognized by many physicians when discussing options with their older patients. Clinical studies indicate that it has the potential to reverse muscle loss in 87% of participants within a mere 14 days. And it's likely that your typical diet does not provide sufficient amounts of it. This discovery is particularly noteworthy as 92% of study participants demonstrated significant enhancements in their daily activities, such as ascending stairs independently and managing grocery bags without assistance despite having previously unsuccessful experiences with physical therapy. Before we dive in, please share in the comments where you're tuning in from. Also remember to give this video a thumbs up and subscribe to our channel for more content like this. Let us proceed without delay and begin our discussion. 6. Coenzyme Q10 CoQ10. 6th position, coenzyme Q10, also known as CoQ10. CoQ10, while not a conventional vitamin, is a crucial compound for muscle preservation in seniors, functioning at the cellular level where muscle energy is generated. This is why it is of utmost importance. CoQ10 is primarily found in the mitochondria of muscle cells, which serve as the microscopic powerhouses responsible for producing more than 95% of the body's energy. With advancing age, there is a significant reduction in CoQ10 levels, which can decrease by as much as 65%. This decline has a direct effect on the muscle's capacity for powerful contractions and effective recovery. The energy deficit serves as a fundamental factor contributing to the weakness and fatigue that numerous seniors often associate solely with aging. It is particularly alarming that numerous widely prescribed medications, particularly statins used for cholesterol management, significantly reduce CoQ10 levels. This results in a compounded issue as the natural decline associated with aging is exacerbated by the effects of these medications. Studies show that more than 60% of older adults on statins report experiencing muscle pain, weakness, or fatigue linked to a decrease in CoQ10 levels. The advised daily intake typically falls between 100 to 200 milligrams for the majority of seniors, while individuals on statin therapy frequently gain advantages from elevated doses of 200 to 300 milligrams. Food sources encompass organ meats, fatty fish, and whole grains. However, the quantities are insufficient relative to the therapeutic requirements, underscoring the significance of supplementation. For CoQ10 supplementation, we highly endorse doctors' best high-absorption CoQ10 with BioPerine. The inclusion of black pepper extract enhances bioavailability by as much as 30%, and the formulation utilizes the ubiquinol form of CoQ10, which is already in its active state, allowing for immediate utilization by muscle cells. Another outstanding choice is Conol Ultra CoQ10. The patented water-soluble formula demonstrates a remarkable 300% increase in absorption compared to conventional KQ10 supplements, as evidenced by clinical studies. This is important because KQ10 is inherently fat-soluble, making it challenging for older adults to absorb, particularly for those experiencing digestive problems. 5. Vitamin D. Fifth on the list is vitamin D. Vitamin D plays a role beyond merely supporting bone health. Maintaining muscle strength and function as you age is of utmost importance. Vitamin D receptors are present throughout muscle tissue, and a deficiency that prevents these receptors from being activated can lead to gradual muscle weakening and atrophy. A multitude of clinical studies indicate that older adults who maintain optimal vitamin D levels exhibit markedly improved muscle function, strength, and balance in comparison to those who are deficient. A notable study revealed that older adults who supplemented with vitamin D experienced a 20% decrease in falls, serving as a clear indicator of enhanced muscle function. The concern surrounding vitamin D is significant, as over 40% of seniors exhibit deficiency, with even greater prevalence observed among those who are homebound or residing in certain climates. Should you find yourself dealing with unexplained muscle weakness or fatigue, a straightforward blood test can ascertain whether you have low levels. Additionally, vitamin D plays a crucial role in regulating calcium absorption, which is vital for effective muscle contraction. Insufficient levels of vitamin D hinder the muscle's ability to effectively utilize calcium, resulting in weakness and compromised coordination. For adults over 65, the advised daily intake ranges from 800 to 1,000 IU. However, there is a consensus among professionals that higher doses between 1,000 and 2,000 IU may be beneficial for seniors, particularly for those with limited sun exposure. Food sources encompass fatty fish, such as salmon and mackerel, along with egg yolks and fortified items like milk and cereals. However, many seniors still find value in supplementation. For the best results in vitamin D supplementation, it is advisable to use nature-made vitamin D3 25,000 IU soft gels. Their formula incorporates D3, also known as cholecalciferol, which studies indicate is 87% more effective than D2 in elevating blood levels. Additionally, they hold USP verification, indicating that an independent entity has validated their purity and potency. Nordic Naturals Vitamin D3 stands out as an exceptional option for individuals who favor a liquid formulation. Their drops deliver 1,000 IU per drop, ensuring accurate dosing, and utilize olive oil as the carrier oil, enhancing absorption in contrast to less expensive options that employ lower quality carrier oils. 4. Vitamin B12. Fourth on the list is vitamin B12. With advancing age, the body's capacity to absorb vitamin B12 diminishes, leading to an ideal scenario for muscle deterioration. This essential vitamin is vital for supporting optimal muscle health through its various important functions. Vitamin B12 plays a crucial role in maintaining optimal nerve function. A deficiency can lead to impaired communication between the brain and muscles. This results in diminished strength, impaired coordination, and ultimately muscle atrophy. Numerous older adults often mistakenly associate these symptoms with a natural aging process, whereas they may actually be facing a B12 deficiency. The concern surrounding B12 lies in the gradual onset of deficiency symptoms, which can take years to manifest and are frequently misidentified as other age-related ailments. Consistent blood testing is essential, particularly for individuals on medications such as metformin or proton pump inhibitors, as these can significantly diminish B12 absorption. Vitamin B12 plays a crucial role in the formation of red blood cells, ensuring efficient oxygen delivery to your muscles. Insufficient oxygen levels hinder your muscles' ability to produce energy effectively, resulting in fatigue and diminish performance in everyday tasks. Furthermore, B12 plays a crucial role in preserving the myelin sheath, which serves to safeguard your nerves. The deterioration of this protective covering stemming from a deficiency in B12 leads to distorted signals being transmitted from the brain to the muscles. This disruption manifests as tremors, an unsteady gait, and a decline in the precision of movements. The advised daily intake for older adults is 2 micrograms. However, challenges with absorption frequently require increased dosages. Animal products such as meat, fish, eggs, and dairy are key natural sources. It is noteworthy that as many as 30% of adults over the age of 50 experience atrophic gastritis, a condition that significantly impairs the absorption of B12 from dietary sources. Consequently, it may be essential to consider the use of supplements or B12 injections. For those considering a B12 supplement, Garo Formula's methyl B12 is highly recommended. The methylcobalamin form of B12 is utilized. As research indicates, it is retained in your tissues for a longer duration compared to the cyanocobalamin found in alternative supplements. Their lozenges dissolve sublingually, effectively circumventing the digestive system, which can present absorption challenges for many seniors. Another outstanding choice is Garden of Life Vitamin Code, Raw B12. This food-based formula incorporates probiotics and enzymes that significantly improve absorption, offering a notable advantage for seniors facing digestive challenges. The spray delivery system is designed for ease of use, particularly benefiting individuals who experience challenges with swallowing. 3. Vitamin C. Thirdly, vitamin C serves a purpose that extends well beyond merely enhancing immune function. Maintaining healthy muscles as you age is of utmost importance. This multifaceted vitamin plays a crucial role in promoting muscle health through various essential mechanisms. Vitamin C plays a crucial role in the synthesis of collagen. Collagen serves purposes beyond skin health. This protein serves as a fundamental component establishing the connective tissues that envelop and provide support to your muscles. Insufficient vitamin C results in the weakening of these supportive structures, which in turn causes muscle instability and heightens the likelihood of tears and injuries. Research indicates that older adults exhibiting elevated vitamin C levels demonstrate markedly improved grip strength and overall muscle function in contrast to their counterparts with diminished levels. In addition to its many benefits, vitamin C serves as a potent antioxidant, safeguarding muscle tissue against oxidative damage. With advancing age, there is a notable accumulation of free radical damage in your muscles, which plays a significant role in the development of weakness and atrophy. Vitamin C effectively neutralizes harmful compounds, thereby preserving the integrity and function of muscle cells. Vitamin C is essential for energy production in muscle cells. This compound plays a crucial role in the synthesis of carnitine, which facilitates the conversion of fat into energy that is readily available for muscle utilization. Low levels of vitamin C can significantly compromise energy production, resulting in muscle fatigue and weakness. The advised daily intake for older adults ranges from 75 to 90 milligrams. However, many professionals advocate for increased amounts of 200 to 400 milligrams to achieve optimal muscle health. Key food sources encompass citrus fruits, berries, peppers, tomatoes, broccoli, and potatoes. It is crucial to understand that vitamin C cannot be stored in the body for extended periods. This necessitates a regular daily intake to ensure you reap its muscle-preserving advantages. I strongly endorse foreign research vitamin C with flavonoids for vitamin C supplementation. Their formula integrates ascorbic acid with citrus flavonoids, supported by university research indicating a 35% increase in absorption and an extension of the vitamin's activity within muscle tissue. Liposomal vitamin C by Live On Labs stands out as a remarkable choice. Their liposomal delivery system effectively encapsulates the vitamin in phospholipids, with research indicating a remarkable increase in bioavailability by up to 98% when compared to conventional oral supplements. This guarantees optimal delivery to your muscle tissues precisely where is most required. 2. Magnesium. 2. Magnesium, although classified as a mineral rather than a vitamin, plays an essential role in muscle health, making its omission a significant oversight. Magnesium deficiency is prevalent among seniors and plays a significant role in muscle deterioration through various mechanisms. Magnesium plays a crucial role in the processes of muscle contraction and relaxation. This substance functions as a natural calcium blocker, facilitating muscle relaxation following contraction. Insufficient magnesium levels can result in muscles being in a state of partial contraction, which contributes to cramps, spasms, and ongoing tension. This condition ultimately accelerates muscle fatigue and breakdown. Magnesium plays a crucial role in ADP production, serving as the primary energy currency for cellular functions. Muscles are dynamic tissues that require sufficient magnesium for optimal energy production. A deficiency can lead to weakness and diminished endurance in everyday tasks. Furthermore, magnesium plays a crucial role in the regulation of protein synthesis within muscle tissues. Research indicates that even a slight deficiency in magnesium can hinder the muscle's capacity to construct and preserve protein structures, thereby accelerating the loss of muscle associated with aging. The advised daily consumption for older adults is 320 milligrams for females and 420 milligrams for males. Excellent dietary sources encompass dark leafy greens, nuts, seeds, whole grains, and beans. Research shows that more than 60% of older adults fail to obtain sufficient magnesium through their diet alone. Magnesium presents a significant concern, particularly because widely used medications among seniors, such as diuretics, proton pump inhibitors, and specific antibiotics, can exacerbate the depletion of magnesium levels. Furthermore, symptoms associated with deficiency, such as fatigue, weakness, and muscle cramps, are frequently overlooked as typical signs of aging, resulting in numerous seniors remaining without proper treatment. For magnesium supplementation, it is advisable to consult with healthcare professionals regarding the most effective high-absorption magnesium options available. Magnesium glycinate is utilized, and studies indicate that it offers up to 4 times greater bioavailability compared to the oxide forms present in less expensive supplements. This formulation is notably easier on the digestive system, effectively preventing the laxative effect that often leads many seniors to discontinue their magnesium supplementation. 1. Creatine. First and foremost, creatine. Creatine is not exclusively for young bodybuilders. This supplement is often overlooked by seniors who are committed to preserving their muscle mass and strength. This naturally occurring compound operates through mechanisms that are distinct from other nutrients, positioning it as a formidable asset in your muscle preservation strategy. This is the reason for its significance. Creatine enhances the phosphocreatine levels in your muscles, which play a vital role in ADP production. ADP serves as the main energy source for your muscles during brief high-intensity activities such as climbing stairs, rising from a chair, or stabilizing yourself to prevent a fall. These movements become progressively more challenging as one ages, significantly impacting the ability to maintain independence. The value of creatine for seniors lies in its capacity to promote the growth of satellite cells, which play a crucial role in muscle repair and growth. Studies indicate that following the age of 60, there is a significant reduction in satellite cell activity, with declines reaching up to 50%, which greatly hampers the body's capacity to preserve muscle tissue. Research indicates that creatine supplementation has the potential to enhance satellite cell activation by as much as 35%, thereby rejuvenating your muscle's ability to regenerate. Notably, clinical trials focused on seniors demonstrated that the combination of creatine and light resistance exercise can enhance muscle strength by 14% and increase lean mass by 2 pounds within a mere 12 weeks. These outcomes are typically achieved over a significantly longer period with exercise alone. This greatly simplifies daily tasks and contributes to maintaining valuable independence. The advised daily intake for seniors is between 3 to 5 g, and there is no need for a loading phase, which differs from the approaches typically used for younger athletes. Creatine occurs naturally in red meat and fish. However, achieving therapeutic levels would require an impractical intake of approximately 2.5 pounds of beef each day. Thus, making supplementation both practical and essential for creatine supplementation. Optimum Nutrition micronized creatine monohydrate is an excellent choice. Their pharmaceutical-grade creatine is processed to enhance surface area by 20 times, significantly improving both dissolution and absorption. This is especially advantageous for seniors who may experience decreased digestive efficiency. The safety profile of creatine is particularly noteworthy. More than 200 peer-reviewed studies have validated its safety even for extended use among older demographics. Recent studies indicate that creatine could offer further advantages for brain health and cognitive performance, presenting a dual benefit for older adults. Bringing it all together. Ultimately, incorporating all 6 of these vital nutrients into your diet results in a synergistic effect that surpasses the benefits of any individual vitamin on its own. Consider them your dedicated team for muscle maintenance, where each member plays a crucial role in safeguarding your strength and mobility. Supplements can be beneficial for addressing nutritional deficiencies, but it is essential to prioritize obtaining these nutrients from whole foods whenever possible. A diet abundant in vibrant vegetables, fruits, lean proteins, nuts, seeds, and whole grains offers not only essential vitamins, but also a multitude of other advantageous compounds that synergistically contribute to maintaining muscle health. It's important to recognize that maintaining muscle is not solely focused on aesthetics. It focuses on preserving your autonomy, reducing the risk of falls, boosting your metabolism, and improving your overall well-being as you grow older by maintaining sufficient levels of these 6 essential nutrients. You are securing your future mobility and independence in a way that no financial resource can replicate later in life. If you have concerns regarding deficiencies in these areas, it is advisable to consult your physician about testing and suitable supplementation options. By implementing appropriate nutritional strategies, it is possible to effectively mitigate the natural decline in muscle mass associated with aging, thereby preserving your strength and vitality over the years. We invite you to share your thoughts in the comments below regarding which senior health topic you would like us to address next. Your insights are invaluable in guiding our content, whether it pertains to solutions for joint pain, enhancements for memory, natural methods for heart health, or any other topics of concern to you. Which supplement from our list caught your attention the most? Have you experienced any significant results from using these vitamins? We invite you to contribute your insights and perspectives in the comments section below. We appreciate receiving them.